Welcome to the Retire Well podcast. We are your hosts, Alicia Kay and Julie Lampy. We're offering a fresh and comprehensive perspective and helping you see retirement through a new lens. We are normally three female entrepreneurs. Our other co-host, Patty Coloca-Masad, is not with us today. We're from Central Florida. We're passionate about serving the pre-retirement, post-career adult. We have an amazing guest today, and I'm so excited to have Julie introduce her, as they were co-workers, which is really exciting.
Yeah, so Laura Arkin is a former co-worker and friend of mine who is a clinical nurse specialist. So she has a master's degree in nursing, and her clinical specialty is in orthopedics. And she's been in practice at Orlando Health for the last 12 years as a clinical nurse specialist. And for most of that time, since 2009, she has been working on falls prevention initiatives in system-wide falls prevention initiatives. And so she is pretty expert on falls, just from that work, very versed in the evidence, but also from an orthopedic standpoint, a lot of falls that have traumatic injury end up on the orthopedic unit. So she can see also the effects of what can happen when you have a fall at home and then you need a hospitalization after that. So without further delay, I am welcoming Laura to our podcast. And one of the reasons we have a 4-series arc on podcasts and on falls podcasts.
We're definitely not expert on podcasts yet.
Yeah, it's Memorial Day weekend. It's Labor Day weekend. It's Sunday afternoon, so forgive us. We have a 4-episode arc on falls, and our first talk is from Claudia, who talks a lot about core training. Harry has been on, and he talked a lot about, from a physical therapy standpoint, like where does core training start? Where does physical therapy begin? Some things that you can do to improve your home. And so what I really want to focus on today is that aspect of, the falls risk in the home, the injuries outside of hip fractures, and outcomes after you've had a hospitalization with a fall. And so, and I'm going to have an episode where I talk a lot about, preparing your home for that, from a remodeling standpoint. And, I'm really passionate about it because, with kitchen and bathroom remodeling being kind of one of my expertise areas, and I know that 80% of all falls with injury happen in the bathroom. So it's a room that I'm familiar with. It's a room I work with. And I think that it fits nicely to kind of introduce that. And then and that your risk for falls increases, triples when you turn 70. And I think a lot of people don't know that. So I'm going to let Laura take it over, talk a little bit more about that kind of data, and then we'll kind of move from there.
Yeah, falls can very much be a detrimental event in an elderly person's life. Statistically speaking, actually working in a level 1 trauma center that is part of our hospital system, the number 1 trauma year to year is actually falls. And that's a very startling statistic. And it is falls all ages, but a larger percentage of those are falls from the elderly. Greater than 3 million across the United States are seen in the emergency department related to falls. And this is actually specifically the elderly category. And generally speaking, they usually quote it as 65 and above, but that's kind of a predetermined age that they usually quote. And of those 3 million falls, about 800,000 are actually hospitalized. And that means the injury is great enough to where they need hospitalization and treatment after their fall. Yeah. So it is quite a, eye-opening number. And unfortunately, the number is going up just due to a lot of confounding variables. And from a cost perspective, and this is also a number, so think about if you could prevent those falls, how much money you could save.
Yeah.
From a cost perspective, in 2015 alone, greater than $50 billion was spent related to falls-related injuries. And of that, Medicare and Medicaid bear 3/4 of that. And that would be, within the elderly population. Most of them generally have Medicare with some type of supplemental. So it is a very, very costly problem. It is, it's a global problem, not just in, the United States.
Right.
But it definitely affects a lot of elderly. And it is preventable. A good percentage of it is preventable, and will be very important with your all's podcasts. Because there are some simple things and some preemptive things that can be done. So that way, someone doesn't become a statistic in the emergency department, using up healthcare dollars of which could be utilized for some other reason.
Right. Well, and then, especially when we say elderly, so that was one thing that, when you said elderly, and it's so funny because I just had this conversation with one of my aunts who's 60, and she certainly doesn't think of herself as elderly, but with the whole COVID situation going on and all the the talk about the elderly, and then she heard them quantify elderly as 60 and older, and she was like, oh my God, they're talking about me. So I think that that's really important to know that, when, as you're hitting the age that you would normally retire, you are physiologically having changes that can lead to falls. And yeah, I think that, looking at falls from a lot of different perspectives is very helpful. And it can be so costly. I mean, I know we talked about, that was one of the things I wanted to talk about, was just one of the things and the big fears, I think, for a lot of people, and the things that injury that they commonly think of is a hip fracture. Mm-hmm. But that's not really the only injury that you can have from a fall. And I mean, we are going to talk a little bit about hip fractures, but I just want to talk a little bit about other injuries that you see that are just as detrimental or just as traumatic as a hip fracture, but that aren't related to that. And then, how many falls do result in hip fractures or other really costly and traumatic injuries?
Some of the most common injuries related to falls, not hip fractures, are actually anything related to the upper extremity. When someone is falling, they don't want to hit their face. They do everything to protect their face, so they fall on outstretched hand. And so you frequently have wrist fractures associated with it, radial fractures, frequently shoulder fractures, because it's a self-preservation mechanism. It's just like if someone were to swing a baseball bat at you, you're not just going to let them hit you, you put your hands up.
Right.
So other frequent fractures are related to the upper extremity, and depending upon if it's a dominant or a non-dominant arm, that really can affect a person's ability to do their activities of daily living, from bathing to hygiene to cooking to cleaning, if it's a dominant or non-dominant. Another injury, other than hip fractures, you can fracture an ankle, because oftentimes if you're walking and you slip, you roll your ankle. So that would be your primary cause of injury. And then, then you potentially could also sustain a hip fracture. Because of uneven flooring or slipping or twisting. Another injury that people don't think about that's not really fracture related are actually head injuries. Those can be the most traumatic. A lot of older folks are on anticoagulation, things to thin their blood. Oftentimes they're on aspirin as cardioprotective to protect their heart from other things, or they're on antiplatelet drugs for whatever other, prior existing health conditions. And what can happen is they go down, they hit their head, and then they sustain a bleed. And traumatic brain injuries are generally actually exceed kind of hip fractures in the rate of morbidity associated with the head injury. Those can be a lot more life-threatening. And that's something, oftentimes there's the folks are on lots of different medications and they don't realize that this medication is the same as this medication, or this medication actually makes this medication work far better, or, you know, thin their blood even more. And so then that puts them at a higher, you know, risk for debility related to falling. That's not even a hip fracture, because most people do, like you mentioned, say, oh, people are going to fall, they're going to fracture their hip. But there's a lot of other injuries that can occur that can be just as debilitating as a hip fracture.
Yeah, I mean, you're talking about the hand thing, and I know you know I'm going to bring this up because of my own personal experience, but I was riding my bicycle a few years ago, and I put my hand down to catch my fall, which when you're going 20-something miles an hour on a bicycle is probably not the best idea, but I did. I put it down, and I broke my hand. I had to have surgery and about 3 months of occupational therapy, because I don't think a lot of people know that, you know, small bones, especially in your hands, manual dexterity in your hands, and, you know, ankle bones, as we get older, and that starts at 40 and above, we're not talking about the elderly, it's much more difficult for those bones and tissues to heal. And when you have to mobilize those for long periods of time, then it starts to heal and the scar tissue builds up. So you, in the therapy sessions, you have to really work past that scar tissue. So you could be looking at months of therapy from an ankle injury or a hand injury, which it sounds so benign, like, well, that's not going to kill me. But when you think about the plans that you have for retirement, the dreams that you have for retirement, a hand fracture, an ankle fracture could sideline you from being able to do the things that you wanted to do, like go on a cruise or travel or garden, or, you know, hobbies that you have. It can sideline you for a while with therapy. So that brings us to the hip fractures, which I think, that's first beyond head injury, because I do think people think about head injuries a lot with falls, and hitting their heads. But hip fractures are a big concern. People know they're bad. I don't think a lot of people are familiar with the morbidity and mortality with hip fractures. So I want you to talk about that and give us some, idea of percentages of people that have hip fractures, the course of treatment, outcomes after hospitalization, etc.
Like I mentioned earlier, the number one reason folks come to our emergency department from a trauma center perspective is related to falls. And of those, so kind of put in the global United States statistic perspective. So of that 800,000 that come to hospitals yearly, or 3 million come to hospitals yearly, 800,000 are hospitalized. Of those 800,000, approximately 300,000 are related to hip fractures directly.
Wow.
So that's some place in the hip. It could be the femur. It could actually be the hip socket. Some fracture related to that are actually hospitalized. And generally speaking, those are almost 100% surgical, meaning that you just don't heal from a hip fracture. Some type of surgery has to be done. Whether it be, they put in a nail, some screws, a rod, or oftentimes they'll either have to put in a total hip replacement, or they'll do a hemiarthroplasty, which is like half of a hip replacement. So depending upon the fracture that the person sustains, will determine what type of surgery they end up having at that time. Surgery is never a benign thing. Undergoing anesthesia, having, the pain associated with the surgery, having to do physical therapy in the immediate postoperative period. These are traumatic things that someone would have to go through if they were to sustain a hip fracture. Generally length of stay in the hospital is anywhere, 2 to 3 to 4 days. People that have more health problems generally will stay longer because all those have to be dealt with, to make sure that the person is optimized to be able to be discharged. From a discharge perspective, about 40 to 50% of patients actually have to go to some type of skilled nursing facility or nursing home after discharge because of the weakness and the rehabilitation that needs to occur after surgery. So that's having a plan. I can't go home. My home is not safe. My home is not ready. I fell in my home. So I have to go to a nursing home or a skilled nursing facility or rehabilitation facility, so that way I can get stronger to be able to go home. That way my family can prepare my home, because my home's not prepared to be discharged back there. The other scary statistic is hip fracture patients, about a quarter will die within a year. Because generally, you're not just a person that has no other health problems at all. There's something else going on. And what can happen is you just kind of start this functional decline after a hip fracture, and then your other health problems just kind of start snowballing. And then you get to a point of no return where you don't have the capacity to bounce back. And then they end up, dying from their hip fracture injury. So those are some very scary statistics. And people that fall, depending upon which source you look at, they will fall, about half to 2/3 of them will fall again within a year.
Yeah. Wow.
So,
Wow.
that, having that functional decline, not having a safe environment, it just, like I mentioned, it all kind of snowballs, and, there unfortunately are about a quarter of the folks that will die within a year related to a hip fracture.
Yeah, and there's some kind of number too of how many days you're in bed in the hospital equates to X amount of days in therapy.
They say 1 day lying in a bed equates to 3 days of recovery.
Okay.
So if you are generally speaking, so they say if you're down and out for 1 day, and and that's even younger healthy people. If someone that might contract pneumonia or something and they end up down and out, it takes about 3 days of recovery. So say you're in the hospital for that period of time, or you're debilitated, it's just 3 times as long to recover, which for older folks, that's often time that's they don't have. They need to not have the injury, so that way they don't have to go through it.
Right. Yeah, especially, and even in the hospital, you have, anytime you have a hospital admission, you have to worry about all types of nosocomial infections and other issues with just being in the hospital. Hate to say that, but it's tough. And if you think about it, and you have an injury that leaves you in the hospital for 5 days times 3, on average, times 3, that's 2 weeks. 2 weeks. 2 weeks of rehab that you're going to need to recondition. So it can be very serious, and I think a lot of people do take those seriously. And I thank you for giving us that number about how often people fall again within the next year. I think that's good information to have, because I think it was one of the points of data that we were trying to figure out in the last podcast that Harry didn't have right off the top of his head. So that's why I added it when I sent you all the questions we wanted to talk about. I figured you would know exactly where to go to find that information. So that's awesome. Alicia, do you have any questions? I can tell that you're chomping at the bit.
I just got so many notes here that this has just been so fascinating. I think the big points for me is I personally, just my father just broke his hip in the middle of COVID in a nursing home, dementia, Parkinson's. So you talked a lot about a lot of the stuff you were saying. I was like, yes, really just it's confirming what I've already experienced with my own father, which was the pre-existing condition. He has not been able to walk since breaking his hip. So there's that massive quality of life change, right? Now he's in a wheelchair and is no longer moving around. And we know that there is going to be a series of health declines due to his lack of mobility, particularly with the dementia and the Parkinson's. So a lot of the stuff you were saying, I was really identifying with. And, we don't go over these stats to scare our listeners or to scare people into action. But it is important. This knowledge is power. This is not something we want our loved ones to have to go through. And beyond being such a massive tax on the healthcare system, what can we do to help support our aging population in preventing this? So this was amazing, Laura. I can't thank you enough for coming on and enlightening us. Julie, you probably already know a lot of this, but for me, this was really cool. Really, really cool. But yeah, thank you again. And like, we have to have you back. Like, I feel like we've just like, you've given us the stats, but I have a lot of questions about the TBIs and the type of head injuries and things like that, and the ankles and arm injuries. And I just feel like there's still a lot more to unpack. Julie, do you have anything last minute before we wrap up here?
I'm excited to have these 3 episodes ahead of us for what I'm going to talk about on the next one on falls, and how we can connect some of the dots between what we've learned in each one of these episodes to how to remodel your home in a way that, you know, it just supports you. You don't have to think about, is this going to cost me to fall? You know, it's just there, and it supports your life every day. So I'm excited to talk about that. Yes. And thank you so much, Laura, for taking time on this Labor Day weekend to have a few minutes with us and share your expertise. We appreciate it.
Thank you for having me.
Absolutely.
Awesome.
So we invite all of our listeners to connect with us on our YouTube channel and our Facebook page. We rely on all of you to tell us what you want to hear. What do you want us to talk about? So we have our hot button topics that we see our clients in crisis facing, and we want to make sure those topics are hit. But if there's something that, you know, resonated with you and you want to hear more about it, just let us know so we can bring amazing experts like Laura back, because today was just so enlightening, and I got a ton out of it, and hopefully you all did too. You can also connect with us individually. My name is Alicia Kay with Try Organizing. Of course, Julie Lampy with Paradigm Interiors, and Patty, who's not with us today, with Coloca Motion. This has just been thrilling. We're wrapping up our arc on falls prevention, and just thank you so much again, Laura, for joining us. And until next time, thank you for listening, everyone.